1, go and smile.
Good evening and welcome to Herts Essex Fertility Centre Open Evening. My name is Soraya Jones. I'm the Deputy Nurse Manager, and joining me tonight is Marna Marks, our Marketing Manager, and Jackie McAdams, who is one of our senior fertility nurses. So Jackie will be able to answer your questions, which you can submit throughout the presentation. I'm just going to move on to the next slide. So tonight we're going to start off with a presentation, virtual tour of the clinic, the Q&As. So as I said, you can submit your questions at any point during the presentation. And if you just use the Q&A icon button to do so, and we'll stay behind online to answer all those questions that are submitted. And importantly, any feedback, which there will be a link provided for. So, brief history of Herts and Essex. The clinic was founded originally as the Essex Fertility Centre in 1989. We have over 34 years of experience and at present over 7,000 babies. All procedures are performed under one roof and we have a state-of-the-art purpose-built clinic. We provide a variety of services ranging from fertility assessments to intrauterine inseminations, looking at fertility preservation, eggs and sperm. We offer donation, surrogacy, pregnancy scans, and the IVF treatments such as IVF, ICSI and PICSI. So to begin with, we do offer, if you're just starting on your journey, thinking about your fertility assessments. The treatment that's included in that is over 2 visits. So it begins with, for the lady, a blood test to check her egg reserve, and that's known as the AMH or anti-Müllerian hormone, and an antral follicle count. So this is a scan looking at the ovaries and looking at the antral follicles at a certain time of the cycle in collaboration with the AMH blood test result. We also offer 3D ultrasound scan of the uterus and a CIS. And a CIS is a saline infusion sonography. So that allows us to look at the womb to explore if there are any findings such as a polyp or any fibroids which could have an impact on your fertility. We also offer hycoses, and a hycose procedure is a test to check the tubes and to see that your fallopian tubes are patent and open, or if there are any blockages. And we also offer semen analysis for the men, and separately we offer a female mini fertility assessment. So just looking at the comparisons between those. So for example, we offer a couple one-stop for the man and woman, and this would be over 2 visits. This includes a blood and urine test for the female, semen analysis for the male, and then coming in for that assessment a couple of weeks later for the saline infusion sonography and for the hycose. Alternatively, if you're just wanting to look and think about if you're a single lady looking at your own fertility, where you are on your fertility sort of status, we do offer a female one-stop. So this would include again the blood and urine test and looking at the tubes and the womb. Alternatively, we offer a female mini fertility, which is just a blood test. So that's an anti-Müllerian hormone, and then just a scan to look at the antral follicle count, really just to see, and in collaboration with those results that we receive from the AMH. Separately, we do offer a hycose. I understand at the moment there's approximately a 9-month waiting list on the NHS for hycose procedures. So it's one way that we can see you just for a hycose separately to help expedite the process for you. So just looking at what involves 3D ultrasound assessment and what this involves, and looking at what the CIS involves in a hycose. So the saline infusion sonography, if we look at the diagram on the right-hand side, is passing a very thin sort of tube, a catheter, into the womb lining, and we inject fluid into the cavity to open up the walls of the cavity so that when we're looking on the left-hand side, the image we see, The uterus is the black sort of fluid filled, and that's a liquid. And then we can see a round structure, which is a polyp in this case. And that's what it helps us to do, is to assess the womb and the cavity. In this case, we would recommend that the polyp is removed to optimize your chances of conceiving and your fertility. The hypocrisy then would involve then using the same catheter or tube and injecting a foam line structure into the tubes to check for the patency of those tubes to see that they're open. If we do find that you have a polyp or fibroids, it may be recommended that you have a hysteroscopy or a laparoscopy, depending, really just to help improve your chances and to optimize you trying to achieve a pregnancy. So if you're wanting to move forward with treatment, and if you have fertility tests which indicate that fertility treatment is needed, we then would move on to a consultation. So our consultations begin with a pre-assessment where you and your partner would both need to attend. You will see a nurse who will initially begin by doing your blood pressure and your pulse. We would need to take your body mass index, so your weight and your height, and just a bold note that saying this must be below 34 for sedation purposes. A blood test for the female, so this is the anti-Müllerian hormone and the thyroid function test. And then for the male, obviously a semen assessment, and he's provided with a pot to produce his sample at home and to return that sample. The consultation then takes place online remotely using Microsoft Teams. You will receive an invitation on the day of an appointment, and at that consultation, the results from the blood test and the semen analysis will be discussed and a plan put together if indeed treatment is needed. We do use a fertility consent online platform where you will be asked to complete certain things in order to register for your consultation, such as ID. We always ask you to bring along any previous tests or investigations you may have had elsewhere. One of the apps that we use, and our patient feedback has been really great with this, is an app called Salve. So this is a secure way you can communicate with the clinic, with the nurses. It reminds you and prompts you about medication, appointment reminders. We can use it to send secure results. So if you've had blood tests, it's a way we can sort of update your records and for you to access those results using your Salve app. So as I said, it's a really valuable tool that you can use throughout your journey. One of the things that we recommend is Fit for Fertility. So healthy body and mind and lifestyle can go a long way to helping you conceive, just to be in that better place when you're looking to achieve a pregnancy. You can visit our website, and we do have some very good pages on wellness and well-being during this time. If it's required that treatment is needed, you will be required to have screening. So this is a mandatory from the HFEA, a governing body, and screening is required for both partners. And it's a blood test which will screen for HIV, hepatitis B, hepatitis C, and a urine test for chlamydia. Additionally, for the female, we will do the anti-Müllerian hormone and a blood test for rubella. So this screens for German measles, and a full blood count to make sure that the female who is intending to carry is not anemic and is well in herself before commencing treatment. When you have your first initial treatment, the results must be within 3 months of starting treatment and must be carried out either at the clinic here or through a UCAS accredited lab. So looking at the treatments that we offer, one of the less invasive and more basic treatment is an intrauterine insemination. So this is a procedure where the healthiest sperm available is introduced directly into the womb. So using a very fine catheter, drawing up the sperm and injecting it straight into the womb. Now, an IUI is used to aid pregnancy, where there may be psychosexual problems, male impotence, or severe premature ejaculation. where we're looking at single women who are using donor sperm, or for same-sex female couples using donor sperm. One of the things that we would recommend that you would need to do before having this procedure is obviously to check that those tubes, the fallopian tubes, are open and patent, and so we know that the treatment is correct for you. So, starting medication. I'm just going to go back. So, starting medication. So, if indeed it is required that you need to have a treatment of cycle of treatment, we would normally do a baseline scan between day 1 to day 3 of your cycle, just as the antral follicle counts, which you can see in the diagram. They look like little black fluid-filled sacs within the ovary. We would then start to stimulate those antral follicles, and that normally starts with medication and injection given at the same time every evening of follicle stimulating hormone, typically beginning day 2 or day 3 of your cycle. The drug that's used encourages or stimulates the ovaries, encouraging the follicles to grow. And throughout the treatment, we bring you in regularly for scans to assess how those antral follicle counts are growing, how they're responding to the medication. The medication can have some side effects, and they can be things like headaches, mood swings. You can get some breast tenderness. And as the ovaries sometimes begin to become more responsive and the follicles are growing, you can feel bloated and your tummy can feel, as I said, a little bit swollen, a little bit tender. During the treatment, on around day 5 of your injections, we bring you back in for another scan. And this is just to check, again, as I said, your response. You then would typically start a second injection. This is called Cetrotide, and this is given at the same time every morning. So you will continue with your evening injection whilst introducing the Cetrotide, the drug in the injection in the morning. And this drug is, its action is to stop you from ovulating. We will continue to scan you regularly to monitor how those follicles are developing and also how the lining of the womb is developing. So the scan picture on the right shows a lovely lining, and you can see the cervix clearly labelled, and we measure the lining, the thickness of the endometrium, where the embryo finally will be transferred. Each scan is followed by consultation with the nurse. So you'll see the nurse after your scan to go through your medication. She will demonstrate how to use the medication, how to store it, do an injection teach, answer any questions you have. And if you remember the salve app, you will also act as a prompt reminding you when to take your injections. Injections are normally given anywhere sort of between 9 to 12 days before the follicles have reached the correct size and you are ready for egg collection. So when you have that final scan, that will determine the date and the time of the egg collection. We'll go through what's required, how to prepare for the egg collection. You then will have instructions to have HCG trigger injection. So this injection is responsible for inducing final maturation of those follicles, ripening them, ready for egg collection 36 hours later. You will receive both verbal and written instructions on when to take this injection and what time you need to come in, etc. So on the day of egg collection, when you come in, you're admitted to the recovery bay. So there'll be a nurse there who will record your observations, your pulse, your respirations, your temperature, your blood pressure. The male, if we're not using donor sperm, will be asked to provide a sample and that'll be prepared. The procedure is done under sedation, and the procedure itself takes approximately, for the eggs to be collected, approximately 30 to 40 minutes. You then are recovery area, and you're normally with us about sort of an average of 2 hours post egg collection. Before you go home, the embryologist will see you and explain the number of eggs collected and give you a little bit more information about the sperm, the eggs they've collected. The recovery team will explain to you about the do's and the don'ts for the remainder of the day, because you would have had sedation, and any discharge information and things to look out for, such as bleeding, pain, and we'll go through those with you. So just to summarise, treatment pathway, as I said, waiting for your period to come, which is day 1, seeing you for a scan between day 1 to day 3 of your cycle, beginning those daily follicle stimulating hormone injections to stimulate the actual follicles so they're nice and mature, scanning you regularly, beginning that second injection on around day 5 of those injections. So you'll be on one in the morning, an injection in the evening, and then depending when the follicles are of the correct size, placing you for egg collection, and then having your eggs recovered, and then looking to see a fertilization, beginning progesterone, and then having a transfer, which can typically be day 2, 3, or day 5. So egg collection day is regarded as day 0, and the pregnancy test, which is done at home, and a urine test typically is done 16 days after egg collection. We do also offer egg freezing, so this is a reproductive technique to preserve fertility. The frozen eggs are stored in liquid nitrogen, and as we are doing more and more of this now, success rates are very good indeed. The law has changed recently. You are now able to store your gametes, your eggs, for up to 55 years, with consent taking place every 10 years. We do know that the quality of eggs are much better at a younger age, and people may wish to freeze their eggs or have different reasons. So it may be for social reasons, it could be due to early menopause, or that you have had chemotherapy as part of treatment for cancer, or about to embark on that, and you wish to freeze your eggs beforehand. The AMH, the anti-Müllerian hormone, which is a blood test, is a really good indication of ovarian reserve. So if that is maybe falling in the lower range, that may prompt you to think about, the best way to manage and preserve your fertility through egg freezing. All through these treatments, we do offer supportive counselling. So, as I said, you will have your self up, you'll have counselling support, you have access to the nurses. So there's a good support network for you whilst you're undergoing treatment. The treatments we offer are IVF, ICSI, or PICSI. So IVF, in vitro fertilization, ICSI, intracytoplasmic sperm injection, and PICSI, physiological ICSI. So these are all different methods of how we put together the sperm and the egg, and that's typically based on the sperm parameters, and that's really what dictates to us in a way what treatment type or choice that the doctor will recommend. So normal sperm, normal treatment semen parameters. So this is according to the WHO 1999 score. So when a gentleman provides a sample of sperm, we would like to see 20 million per mil. We'd like to see 50%, so half of that being mobile and moving. Progression is 2 out of 4, normal forms 15, and the HbA score 65% and above. So the HbA score tells us a little bit more about the sperm and its maturity within that sample. When may ICSI be required? So ICSI may be considered and recommended if we have low sperm parameters. So whether that be in the count, the motility, or the amount of abnormal sperm that we're seeing, or there's no sperm in the ejaculate, in which case we may look at doing or recommend surgical sperm removal for the men. If it's MAR positive, so anti-sperm antibodies, so the sperm is clumped together and can't swim freely, and where we may have had previous treatment and there's been previous failure to fertilise or very low fertilisation rate. So I'm just going to click onto this picture, and this gives us a little bit of an ICSI technique. So you can see the pipette and the sperm swimming freely. In order for the sperm to be injected, you'll see very shortly, the tail has to be flicked to immobilise the sperm, to draw it up. So we'll just see that happening. The sperm's just swimming freely. You can see that the pipette's just wiping and trying to just the tail to immobilise it and then drawing it up. Once the sperm's been drawn up, it's injected into a mature egg. So this is now the sperm being injected with the using the pipette, as I said, into a mature egg. Okay. And you can see the sperm just making its way down the pipette there and being withdrawn. ICSI. So ICSI is another method of where we put the sperm and eggs together. And PICSI, as I said, is recommended maybe where there is lots of immature sperm present in the sample. So mature and immature sperm look the same. However, immature sperm have failed to complete their final stages of development. And with this in mind, immature sperm have high rates of DNA fragmentation and can lead to high rates of abnormal chromosome numbers. So ICSI bypasses this natural selection of mature sperm by the egg, and the immature sperm selected for ICSI can achieve fertilization, however, can result in poor embryo quality and miscarriage. So that PICSI is just another selection process, another method where if it's indicated and there's lots of immature sperm in the sample, it's a way of selecting the mature sperm to then inject into the egg. When the eggs are being collected and mixed with the sperm, as I said, egg collection day, on the day of egg collection, that's considered as day 0. On day 1, we look at signs of fertilization, and what we're looking for are 2 what we call pronuclei. So the 2 round structures you can see. We then go on to where we expect the embryos to then start to divide and cleave. So on day 3, we would expect the embryos to be between 6 and 8 cells, and they carry on dividing and cleaving until hopefully they reach this lovely blastocyst stage. So we have the inner cell mass just here, which goes on to make the baby. And on the outside, these cells here are called the trophectoderm cells, and these go on to make the placenta. On day 6, in order to implant the blastocyst, the egg has to hatch. So here on the right-hand side, we can see the shell-like structure and the blastocyst there, where it's hatched out of its shell. On day of embryo transfer will be based on the number of fertilized eggs and the number you would like transferred. Embryo transfer takes place 7 days a week, so if it falls on a Sunday, absolutely we are here open, ready, to have your embryo transferred, so maximizing your chances of pregnancy. You'll be given an opportunity to see your embryos. So you and your partner can both come in on day of embryo transfer. You can both go into theatre on this day. You'll be able to see your embryo that's been transferred up on the television screen. You'll get a picture to take away with you as well. We do offer an add-on called Embryo Glue. It's offered to all patients. It's a transfer medium which mimics the conditions in the female uterus in order to help the embryos implant after transfer. We do offer pre-implantation genetic testing. It is a way just to, for us, it allows us to genetically test your embryos to help optimize your chance of pregnancy, and you can see the different types of PGTA that we offer. So we offer PGTA, PGTM, and PGT-SR, and it clearly indicates so. So PGTA, it determines whether the correct number of chromosomes are present in the embryo. PGTM, this screens for single gene disorders such as cystic fibrosis, the BRCA gene 1 or 2, or Huntington disease. And then PGT-SR looks more at the structural rearrangements and screens for imbalances or screens for chromosome rearrangements. So that's just a service that we offer. We have an IVF witness system, so all your gametes, sperm and eggs are tagged, electronically tagged at the beginning of the cycle. And as they're transferred and moved in the lab to witness, to put in the hood, to look under the microscope, at all points this ID card is used so to negate any human error. So all, as I said, sperm, eggs and embryos electronically tagged. It provides traceability of all lab procedures, and its procedures are carried out in designated witnessing stations, hopefully providing you with further reassurance. Pregnancy test, as I said, and a fresh cycle of treatment is done 16 days from egg collection. And if you have a positive test, we do offer an early viability scan around the 7 weeks mark. So this early viability scan is checking to see that we can see baby that's sitting in the right place. We can see a nice fetal heart and fetal pole. We do also offer screening further on, a minimum of 10 weeks of NIPT, which is a non-invasive pregnancy prenatal testing, which is a blood test and a scan, which screens for certain genetic disorders. Other treatments that you may wish to consider is egg donation, sperm donation. So you may want to look at using donated eggs or eggs that have for donation because of age, because you've embarked on early menopause, you have had to have chemotherapy, poor egg quality, born without ovaries, or needed for a surrogacy cycle. You may consider sperm donation or using donor sperm if there is no sperm production. Again, if you've had to undergo chemotherapy treatment for certain genetic disorders, if you're looking to have treatment as a single lady, and for our same-sex couples. So surrogacy. So we are one of the leading centres in the UK for surrogacy, and surrogacy is when someone agrees to become pregnant and have a baby for someone else. So two parties are involved with this, the surrogate, so the person who carries the baby, and the intended parents. Often the only option for women unable to carry a baby to term and for male sex couples. There are two types of surrogacy. There's full host surrogacy and there's partial or straight surrogacy. There are some changes going on at the moment in the background with regards to the law surrounding surrogacy, and hopefully in the new year we may see some changes in that. If we also do have a contract with the NHS for NHS funded patients, and this is with Mid and South Essex and the integrated care boards, and these areas would cover Mid Essex, Castle Point and Watchwood, Basildon and Brentwood, Thurrock or Southend. So as I said, we do see NHS funded patients, and the other integrated care board that we work with is with North Central London, and they will cover Barnet, Camden, Enfield, Haringey or Islington. So if you're finding that you do need treatment, and you can check with your GP if you think you would be eligible for NHS funding with us. So if you are not eligible for NHS funding and you're looking at other ways maybe to move forward with your treatment, you could consider egg or sperm share for funded IVF. So programs to consider would include egg sharing, sperm share, freeze and share. I just want to draw your attention to the freeze and share. So freeze and share would be maybe your consideration to do egg freezing, where you would freeze half your eggs and the other half would be for donation. So included in that would be your saline infusion sonography, if you are having an embryo put back, male and female screening, so the HIV, the hepatitis B, and the fertility drugs. Fertility treatment cost will depend on, and can vary depending on your individual needs and circumstances. The prices are on our website. They're very transparent. You can see, the cost for each cycle of treatment there. This does exclude, just to draw your attention, so this does not include the cost of screening or any medication. We do work in collaboration with a company called Herts Essex Fertility, who do offer packages, funded packages, that to assist you in payment for fertility treatment. So they do packages as IVF Unlimited, IVF refund packages, and IVF multi-cycle. During the time of having fertility treatment, we do recognise it can be very difficult, and we do provide lots of emotional support against internal and external factors. So, positive vibes. We're very, you can access through Facebook, tweeting. We have supportive counselling. We have patient group on Facebook. So there are lots of ways you can receive that support, from us whilst you're undergoing treatment. So for those of you looking to optimise your well-being overall, we do work with the and dietitian. If you do feel that you would like to access that, you can use the British Dietetic Association to find maybe a dietitian that matches your criteria, and just click onto the link on our webpage, and that will direct you to someone maybe more locally who can assist you with that. So why us? Well, we have over 34 years of experience. We're a 7-day-a-week laboratory service. We have an electronic witnessing system in place. We have over 7,000 babies. We support you through your treatment, and we recognise, I think, the emotional impact it can have for you and your partner when you're undergoing fertility treatment. So I think I would like to point out just a 7-day-a-week service and everything being under one roof. That's so important when you're undergoing fertility treatment, that you know that your consultations, your scan, the day of egg collection and the day of transfer, coming back to have your scan if all is well, and offering you that pregnancy scan. It's a whole journey from beginning to end, and that's something that we are able to offer, as I said, 7 days a week. We value your feedback, so anything we can do to improve the presentation this evening, we do really value. So please complete the short survey, how we can improve the event. There will be a link sent in the Q&A chat and also by SMS tomorrow. Stay connected to us. So there are many different platforms that you can use to hear about the latest fertility news. So you can access us on social media such as Facebook, tweet us, Instagram, etc. So to make an appointment with us, you can telephone us on the number given there, so 01992 785060. You can email us. So that initial consultation, that new consultation, is available now. Looking through our diary, will next be available in the new year. The appointment for this includes, as I said, that pre-assessment where the blood test is taken for the lady's anti-Müllerian hormone, the thyroid function test, the semen assessment for the male, and then the consultation, which is done remotely using Microsoft Teams. So what you're going to see next, just a virtual tour of the clinic. Do forgive me, I think that the sound is not working on the link, so apologies for that, but we can provide a link with the sound. Please do remember to submit any questions you may have, and we will come back to you. So, thank you very much for your time. I'm now going to move on. Let's just go back one onto the tour. Bear with me one moment. Okay, I think there's a little bit of a technical hitch, so I think we're going to have to send out the separate link for the virtual tour. Let me just go back one. Oh. Okay. Apologies again for that technical hitch in just showing you the virtual tour. I'd just like to take the opportunity to say thank you very much, all of you, for joining us this evening. We appreciate it's a really busy time of year, so thank you very much, and we hope to see you in the new year. Thank you and good evening.